When the ability to quickly assess critically ill neurological patients is needed, the Ceribell Rapid Response EEG resolves the challenges of conventional systems by providing an intuitive, one-stop solution for quick and accurate triage of brain activity. Now, with Clarity, Ceribell continuously monitors the EEG in real time and can automatically detect and rule out seizures. Clarity is the only FDA-cleared tool that provides an instantaneous bedside alert when brain activity consistent with status epilepticus is detected, enabling clinicians to intervene quickly when the patient is at risk. Based on the American Clinical Neurophysiology Society standards, Clarity is the first FDA-cleared system to measure brain activity throughout the recording and quantify the amount of seizure a patient is experiencing over time. The seizure burden graph makes it possible to monitor the response to medication both at the bedside and using the Ceribell online portal in real time. Clarity is a software algorithm that enables continuous and real-time quantification and trending of seizure burden. Seizure burden is the percentage of time that the software has detected EEG consistent with seizure or epileptiform activity within the last 5 minutes. Measuring seizure burden is a way to objectively quantify the burden of epileptiform activity. Clarity measures and updates seizure burden every 10 seconds for the preceding 5 minutes of the EEG. Once an EEG recording has been started on the Ceribell recorder, Clarity will automatically start monitoring the EEG to determine the seizure burden. Click the seizure burden icon to open the seizure burden trendline display. Each point on the trend line represents the seizure burden value calculated over the previous 5 minutes. Before there are 5 minutes of EEG data, there will be no seizure burden information to display. After 5 minutes, Clarity will begin to update the trendline graph in real time. The most recent seizure burden value will be displayed on the right side of the screen. The seizure burden trendline allows you to see how the seizure burden has changed over the last hour of the recording. You can also scroll along the trend line if you would like to see the seizure burden from earlier in the recording. Clarity will continuously monitor the EEG, and an audible notification on the recorder will be triggered when the seizure burden crosses 90%, indicating continuous seizure activity and risk of status epilepticus. Once the audible notification has been triggered, click OK to clear the warning alert. You will be brought directly to the seizure burden trendline display. You can turn the audible notification on and off, or mute it for a period of time by pressing the sound icon on the seizure burden screen. To mute the notification for a specified length of time, press Mute and select the amount of time you would like the notification to remain silenced. Then select Done. The recorder will count down how much mute time remains. You can also disable the audible notifications by pressing Off. The recorder will ask you to confirm you want to disable the audible notification because it will not turn on automatically for this recording once it has been turned off. The seizure burden screen will show you whether the audible notification is on or if it has been muted or disabled. Clarity is a cloud-based software and requires a Wi-Fi connection to operate in real time. If the Wi-Fi connection is interrupted during the EEG recording, the Ceribell recorder will continue the EEG recording, but the Clarity seizure burden trendline will not be updated until the Wi-Fi connection is re-established. A notification will sound to alert you that Wi-Fi connectivity has been lost. Ceribell with Clarity also has accurate and easy annotations capability. Bedside clinicians can mark important observations by pressing the flag button. These observations will appear on the portal so the EEG reviewer will have more context in the recording. There are 3 categories: anti-epilepsy medications provided at the bedside, patient observations, and free text observations can also be entered. On the medication screen, commonly prescribed anti-epilepsy medications are listed. Multiple medications can be selected or deselected. On the patient observation screen, a variety of patient observations can be selected, as with medications. Seizure burden is a way to objectively quantify the burden of epileptiform activity. It is the percentage of time this activity has been detected in the last 5 minutes. Seizure burden is updated every 10 seconds for the preceding 5 minutes of the EEG. Clarity is the first tool to provide continuous, real-time quantification and trending of seizure burden, both on the Ceribell recorder and on the Ceribell portal. A clarity alert at the bedside is an indication that the patient may be experiencing continuous epileptiform brain activity or may be in status epilepticus. Use the Ceribell Rapid Response EEG with clarity to make the best and fastest diagnosis for your patients.